Reality hit me when I started working at a detox center, and about 80% of the clients I work with are coming off of crystal meth.
I work in an inner city hospital acute psych intake unit, and most of our patients abuse crystal meth. We decided to bring this video to you about one of the most abused drugs of our generation, crystal meth. And we decided to talk to kids about it because we're seeing a lot of young kids getting on this stuff, and they're abusing it to the point of psychosis, and then they're truly struggling to get off. Crystal meth produces the mother of all dopamine releases that pretty much trumps anything else out there, and is one of the most dangerous psychoactive drugs. We wanted to lay out the facts about crystal meth to you so you can make an informed choice when you're offered this drug, because chances are you will be, and no one can control your choices. But if you know it's going to go down once you get involved with this stuff, we can only hope that you're going to choose to say no.
Crystal meth is a central nervous stimulant drug that is highly addictive. Chemically, it is related to amphetamines, but the effects are much stronger on the central nervous system. This means that it has a high potential for abuse, and long-term abuse may cause severe physiological or psychological dependence. Crystal meth is also known as ice, blade, glass, or quartz, and it is made in illegal labs. It is made from lethal substances such as battery fluid, drain cleaner, lantern fuel, and antifreeze. Individuals who use meth are at a greater risk of suffering from brain damage, heart attack, or stroke. Globally, crystal meth affects 25 million users and is used by 1.2 million adults across America each year.
Crystal meth is one of the very few drugs out there that crosses the blood-brain barrier. It works by affecting the communication chemicals dopamine, norepinephrine, and serotonin in the brain, and activating the cardiovascular and central nervous systems. Dopamine is the neurotransmitter responsible for creating feelings of pleasure. Crystal meth acts by releasing massively high amounts of dopamine that has nowhere to go. Your brain doesn't have the capacity to handle that much dopamine. Because this all takes place inside the brain, it's hard for scientists to track exactly what it does do. But what we do know is that chronic meth users develop severe disruptions in levels of protective proteins in the brain, which may lead to a decline in nerve cell protection, which explains the brain damage associated with crystal meth use. According to the 2011 Drug Abuse Warning Network report, the number of meth-related emergency department hospital visits increased from 68,000 in 2007 to 103,000 in 2011, a space of 4 years. DrugRehab.com states that graphic side effects make crystal meth one of the world's most voracious drugs. It causes violence, aggression, malnutrition, fatal kidney and lung disorders, liver damage, brain damage, strokes, respiratory and airway abnormalities, depression, tremors, seizures, jaw clenching, blurred vision, severe acne, schizophrenic symptoms including hallucinations and paranoia, delusions of parasites crawling under your skin, homicidal and suicidal thoughts, microvascular hemorrhage, reproductive issues including extreme birth defects for all of you out there who would like to have a child one day, and it causes meth mouth, where all of your teeth rot and fall out, and they're still not sure why that happens.
When an addict stops using crystal meth, the levels of dopamine in the brain decrease, which causes withdrawal. Withdrawal from crystal meth causes extreme cravings.
In 2007, 8% of people aged 18 to 26 reported having used crystal meth in the past year.
In 2004, and upwards of 3,000 children were removed from meth labs across America.
According to the 2012 National Survey on Drug Use and Health, the average age of first use of crystal meth was between 8 and 22 years of age.
In Canada, young people make up the largest group of crystal meth users.
In Canada, young people make up the largest group of crystal meth users.
In Canada, young people make up the largest group of crystal meth users.
Whether it's for yourself or someone you care about, you can call 1-800-663-1441. The service is confidential, multilingual, free, and available 24/7.